Hi, welcome to Dr. Medics. Anatomy of male genital organs. Part 2 Scrotum. Introduction. Cutaneous bag containing right and left testes, epididymis, and lower parts of the spermatic cord. First point is externally, the scrotum is divided into right and left parts by a ridge or a raphe, which is continued forward and backwards. Forward continues under surface of the penis and backward continues middle of perineum to anus. Third point is influence of hot and cold in the scrotum. In hot, especially in young and robust people, the scrotum becomes short, corrugated, closely applied to testes because of the contraction of the dartos muscle. In hot circumstances, especially in old debilitated person, the scrotum becomes elongated, flaccid because of the relaxation of the dartos muscle. The fourth point is dartos muscle helps in regulation of temperature within the scrotum. Layers of the scrotum. Scrotum is made up of skin, dartos muscle, external spermatic fascia, cremasteric muscle and fascia, internal spermatic fascia. The first layer is the skin, second one is the dartos muscle, and third one is the external spermatic fascia. Fourth one is the cremasteric muscle and fascia. Fifth one is the internal spermatic fascia. In deep, parietal and visceral layers of tunica vaginalis is present. In deep to that, the testis is present. Blood supply of the scrotum. Superficial external pudendal artery, deep external pudendal artery, scrotal branches of internal pudendal artery, cremasteric branch of inferior epigastric artery. Nerve supply of the scrotum. So the first one is the dartos muscle, which is supplied by the genital branch of genitofemoral nerves, and the scrotum is divided into anterior and the posterior parts. So the anterior anterior one-third scrotum is supplied from the segment L1 of a spinal cord through ilioinguinal nerves and genital branches of genitofemoral nerves, and the posterior two-third scrotum is supplied by the segment S3 of spinal cord through posterior scrotal branches of pudendal nerves and perineal branch of posterior cutaneous nerves of the thigh. And the anterior and posterior areas are separated by a ventral axial line. Testis. Testis is male gonad, homologous with ovary of a female, suspended in the scrotum by a spermatic cord. Lies obliquely so that its upper pole is tilted towards and laterally. Left testis slightly lower than the right one. Shape and size. Oval in shape and compressed from side to side. 3.7 cm long and 2.5 cm broad from before backwards. 1.8 cm thick from side to side, and adult testes weight about 10 to 15 kg. External features of the testes. There are two poles, upper and the lower pole. Upper pole is convex and smooth, provides attachment to the spermatic cord. Lower pole is convex and smooth. Second external feature of testes is two borders, which is anterior and posterior. Anterior border is convex, smooth, fully covered by tunica vaginalis, and posterior border is straight and only partially covered by tunica vaginalis. Epididymis lies lateral part of the posterior border. Third external feature of the testes are surfaces. There are two surfaces, which is medial and lateral. Both the medial and lateral surfaces are convex and smooth. Medial surface of epididymis is separated from the testis by an extension of the cavity of tunica vaginalis. The extension is called the sinus of epididymis, and attached to the upper pole of the testis, there is a small oval body present, is called the appendix of the testis, which is a remnant of the paramesonephric duct. Coverings of the testis. The testis is covered by layers of the scrotum. In addition, it is also covered by P-coats, which is tunica vaginalis, tunica albuginea, tunica vasculosa. Tunica vaginalis, which is the first covering of the testis. It consists of lower persistent portion of the processus vaginalis. It is invaginated by testis from behind and therefore has a parietal and visceral layer with a cavity in between. Covers the whole testis except fortis posterior border. Tunica albuginea. Dense white fibrous coat covering the testis all around. It covered by visceral layer of tunica vaginalis except posteriorly where the testicular vessels and nerves enter the gland. Posterior border of tunica albuginea thickened to form an incomplete vertical septum called the mediastinum testis. Numerous septa extend from mediastinum to the inner surface of the tunica albuginea. They incompletely divide the testis into 200 to 300 lobules. Tunica vasculosa. Innermost vascular coat of the testis lining its lobules. Structure of the testis. Glandular part of the testis 200 to 300 tubules. Each tubule consists of 2 to 3 seminiferous tubules. Each tubule is highly coiled on itself. When stretched out, each tubule measures about 60 cm length and 0.2 mm in diameter. Tubules are lined by cells which represent stages in the formation of spermatozoa. Seminiferous tubules join together at apeces of lobules to form 20 to 30 straight tubules which enter the mediastinum in mediastinum which are anastomosis to form the rete testis. In its turn, the rete testis gives rise to the 12 to 30 efferent ductules emerges near the upper pole of the testis, enters the epididymis. Here, each tubules become highly coiled and forms a lobe of the head of epididymis. The tubules end in a single duct which is coiled on itself to form the body and tail of epididymis, which continues with the ductus deferens. Blood supply of the testis. Artery supply. Testis is supplied by the testicular artery, branch of abdominal aorta, at the level of L2 vertebrae, which descends on the posterior abdominal wall to reach the deep inguinal ring, enters into the spermatic cord at posterior border of the testis, divides into branches. Small branch enter posterior border, whereas the large branch enter medial and lateral. Pierces the tunica albuginea, run on the surface of the testis to ramify in tunica vasculosa. Venous drainage of testis. Veins emerging from testis form pampiniform plexus. Anterior part of plexus arranged around testicular artery. Middle part around ductus deferens and its artery. Posterior part is isolated. Plexus condenses into 4 veins at superficial inguinal ring and 2 veins at deep inguinal ring. These 2 veins accompany the testicular artery. Ultimately, one vein formed to drain into the inferior vena cava on the right side and left renal vena cava on left side. Lymphatic drainage of the testis. Lymph from testis ascend along the testicular vessels and drain into the pre-aortic and para-aortic groups of lymph nodes at the level of second lumbar vertebra. Nerve supply of the testis. by sympathetic nerves arising from segment T10 of spinal cord, pass through renal and aortic plexus. Nerves are both afferent for testicular sensation and efferent to blood vessels. Histology of seminiferous tubule. A seminiferous tubule consists of cells arranged in 4 to 8 layers and fully functioning testes. These cells are of two types, namely spermatogenic cells forming the vast majority, the supporting or sustentacular or cells of serotoli. The spermatogenic cells include spermatogenia, primary spermatocytes, secondary spermatocytes, spermatids, and spermatozoa. The cells of serotoli are tall and columnar in shape, extending from the basal lamina to the central lumen. They support and protect the developing germ cells and help in maturization of spermatozoa. Spermatogenesis is controlled by follicular-stimulating hormone of the anterior pituitary. Interstitial cells or cells of Leydig are found as small clusters in between the seminiferous tubules. They secrete testosterone or androgen. The activity of Leydig cells is controlled by interstitial cell stimulating hormone of the anterior pituitary gland. Epididymis. Introduction. An organ made up of highly coiled tube, acts as a reservoir of spermatozoa. Parts. Upper end, which is head, made up of highly coiled efferent ductules. Head is enlarged and is connected to the upper pole of the testis by efferent ductules. Middle is body and lower is tail. Both are made up of single duct of epididymis, which is highly coiled by itself at lower end of the tail. This duct becomes continuous with the ductus deferens. Vessels and nerves of the epididymis. Epididymis is supplied by testicular artery. Vessels and lymphatics are similar to the testis. Epididymis is supplied by sympathetic nerve through the testicular plexus. Fibers derived from segment T11 to L1 of spinal cord. Histology of epididymis. Tubules of epididymis lined by pseudostratified columnar epithelium with stereocilia. Tubules are surrounded by connective tissues.